Hi, everyone. Welcome back to the Pelvic Pulse podcast. I have a special guest with me today, and this is actually the first time I'll say that I've ever accepted just an open, kind of random invitation to do an interview and have a conversation. This is Dr. Lynn Schulte. She is a pelvic health physical therapist for over 30 years, and she is the principal instructor and founder of the Institute for Birth Healing. She has successfully healed thousands of women from all the issues women experience after birth and is now teaching courses to body workers to help them do the same. She found a common birth pattern, which I'm so excited to talk about, that shows up in the pelvis after birth and knows how to effectively release these patterns. Knowing we are more than just our bodies, Lynn works on all levels, physically, energetically, and spiritually, with women to help them access their full potential. Speaking my language. She also teaches body workers how to work with the energy of the body and how to access and use your intuition in your bodywork sessions. She offers a certification process to help birth professionals become birth healing practitioners. Lynn holds a Bachelor of Science from or in physical therapy from St. Louis University in St. Louis, Missouri. And welcome to the show, Lynn Schulte.
Thank you so much, Brittany. It's so great to be here. I so appreciate any opportunity I get to share the wisdom that I've learned from the body over the years.
Yeah, I mean, we were talking obviously off recording for a little bit and learning a bit more about each other. And I'm so curious, just maybe giving a little backstory on how you got to become a founder of Birth Healing
Ah,
for
well,
yourself.
I was living in Seattle, Washington, and had my own practice in there. And then we were moving to Boulder, Colorado. And so I had to start all over again. And one of the ways that I was building my practice was by offering free classes to new moms
Mm,
and, helping them to understand why does their belly feel the way their belly does. And I started to educate them on that. And then I started seeing just postpartum clients in my practice.
mm,
And I think that was the key for me to be able to discover the patterns that I found because I kept seeing it in every single person who would lay down. Their pelvis would rotate all to the left. So the right ASIS would be higher towards the ceiling, left side would be lower. And it wasn't a decreased mobility in the SI joint, like the ilium were moving. And I was like, what is this? And I just got curious with the body and started palpating, and I had taken some courses with I love how all the courses I've taken throughout my career have all lined up to help support me in working with the postpartum body, because I took this course with Jerry Hesh on spring testing of the pelvic bones, and so I was spring testing all the bones and figuring out what was going on, and I realized that the sacrum had kinda sheared off to the right
mm.
and created this, side bending, shearing, whatever you wanna call it, and it wouldn't move in another direction, and when I corrected it, that rotation went away.
Wow.
And then these moms who were coming in to see me were having right side low back pain. They had been seeing chiropractors and massage therapists for months, and they laid down on my table, and I would do that 2 techniques, and in 5 minutes, they were out of back pain. And then I started to just really listen. So I've taken visceral manipulation, I've taken craniosacral therapy courses, and that really just heightens your palpation skills and
Mhm.
being able to what you're touching in the body and sensing in the body. And I started to notice that the bones of the ischial tuberosities, I call them ischiums because they're less syllables, but the ischiums were, like one was more splayed out to the side. And as I was like looking at it, I'm like, why would one side be more out to the side than the other? I'm
Mhm.
like, doesn't the baby just come straight through the midline? And so I kept seeing that though. And so I went and got my anatomy books, I went and got birth books and tried to understand what do the bones of the pelvis do in order to birth a baby. And the sacrum has to go back into flexion for the baby to come out, and the sit bones have to widen. And then understanding kind of biomechanics and the motions of the pelvis and realizing that, oh, well, if someone's laying on their left side, that ischium can't open up because the ground's there. So
Mhm.
the right side's gonna have to open up more. And that's why I kept finding, I would associate what I was finding in the body with their birth position. And
Right.
the ischium would be out to the side if that leg was bent up while the baby came out.
So are you
And
saying most of the clients that you saw postpartum, they were giving birth, like, a lot of the times on their left side?
sometimes, yeah. So if I, usually what I would find, well, I always ask my moms, I'm like, so what position were you when your baby came out?
Mhm.
And then I take that information of knowing what was going on mechanically in that position and then go search the bones and see what I felt and found in the pelvis.
Mhm.
And you can totally assess this and just look at the PSIS angle to ischial tuberosity angle, look at one side, and it should be the same on the other side. But when it's wider, then you know that that ischium is abducted or splayed laterally. And that's what I kept finding. And then sometimes I'd find both bones
Mm,
apart.
mm,
And then later on, I started realizing how much sacral flexion is being held in the body.
mm,
And these moms that would come in, they back pain, pelvic pain, and they would feel unstable, ungrounded. And they sometimes they did if they had a lateral splay of one side, they're like, I just don't feel like I can sit evenly. That makes sense, doesn't it? If one ischium is not directly underneath you like the other, you're gonna feel a little off when you sit down. So everything made sense. What I was finding in the body, the position they were in birth, and then their complaints. And so I just figured out a way to help bring the bones back together and get them out of what I'm coining the open birthing pattern in the pelvis. Because
mm.
the pelvic bones have to open for a baby to come on out. And what I'm here to say is they do not always return to their original position. And everybody in the world thinks they do. And nobody's looking for this.
Mhm.
And chiropractors, OBs, PTs, nobody's looking for this, you guys.
Right.
And I've been teaching, so I've had such tremendous success with my clients that I put together some courses. I started in 2016 is when I founded the Institute for Birth Healing, started teaching my first courses. And since then, I've been teaching thousands of people how to help close the bones back up after birth. And they're getting the same amazing results as I do. And
Mm.
students who come take my courses, I hear from them all the time. Oh my gosh, all my clients that were plateauing before, they're now all better. My clients are getting off the table and saying, that's the work I feel like I've needed my whole life. People are
Yeah.
getting off the table after their bones come back together, if a PT helps them get their bones or an OT helps them bring their bones back together. And they're like, I feel more stable.
Mhm.
Well, doesn't that make sense?
It does, it does. I mean, kind of like I compare a lot of, like, pelvic PT sessions to sometimes, like, vestibular sessions because, with vestibular, like, inner ear stuff, sometimes it takes, like, 1 or 2 things.
Yeah.
And it's similar to the pelvis. Like, it can be so responsive that with the appropriate touch, the appropriate technique, the appropriate activation afterwards, there's just this rebalancing that can feel instantaneously better. I could totally envision it. Yeah.
Yeah. But what's interesting though, Brittany, is that not a lot of pelvic health PTs know how to address the pelvis.
At least not in a holistic way. Like,
Yeah,
that is
true.
something that I feel like I've had to learn over the years
Right, on your own, right? Or
on my
or
own.
or taking other courses because it's not
Correct.
taught in pelvic health PTs
No,
courses.
no.
The pelvis is not addressed in any pelvic health PT course. And what I want people to understand is that chiropractors and PTs, we understand that there's an anterior posterior rotation of the ilium.
Mhm.
We know that there can be an in-flare and out-flare of the ilium. We know there can be upslips if you fall, the pelvis can get jammed up. But what we're not looking at is this in-flare, out-flare of the ischium and the ilium.
Mhm.
And that's what's happening after birth. And I tell you, I have a free online course called the Sacral Flexion Pattern Course. And it's all the symptoms that your clients will complain about. Number one being they can't lay on a hard surface. It
Yeah.
hurts their sacrum to lay on a hard surface because the sacrum's too far back. And this is, I call it the most hidden, it's the most common yet hidden pattern in the postpartum body
Mm.
because we don't, there's no way to really assess for this or to even notice that it's a thing, but there are some really big telltale signs that the sacrum is stuck in flexion, and that's one of them. People can't lay on a hard surface. That just hurts. But I teach a lot of mobilization techniques to the pelvic bones, and
Mm.
all the bones should give and move. And I call it hardened bone when we have an osseous lesion in the bone. That bone should be spongy and give a little bit. But if we've had an impact, and birth can impact the bones actually become really hard. And that osseous lesion creates it creates this hardness in the bone. And that's what I'm sensing in my hands. Is like
Mm.
normal bone has a little bit of give. Similar to like a tree that's a young tree, that bends in the wind versus a telephone pole.
Right.
That's the difference between normal bone and hardened bone. That normal bone should have a gentle give and a spring to it a little bit, and you can feel it. And where I feel it the most, one of the other common patterns I find is the left pubic bone rami area.
Mhm.
Normally, the larger part of the baby's head comes through on that side, and it just makes this bone hard, which can activate the adductor muscles that attach to it. So if your
Mm.
mamas are complaining of adductor or you have pain or tension in the adductors, and I hear this all the time from my moms that have this issue. They're like, oh, I see a massage therapist and it feels better for a day, but then it comes back. Well, it's because it's attaching into this hardened bone and the bone's not happy. So it's going to activate whatever's attached to it.
Yeah.
And so you soften the bone and then the muscles can relax and let go.
And so all these techniques that you're teaching, they are hands-on, and I'm assuming, hands-in.
Yes. So I have a intravaginal protocol that I teach that is just out of
Mm.
this world. I think. I mean, it just creates amazing, amazing results when you. So just so we know, like most pelvic health PTs are taught to just address the muscles in the
Mhm.
pelvic area, and they're missing out on, I call it the bladder and the cervix, but it's really the endopelvic fascia and the cervical fascia that we're addressing here. But actually, the reason I call it the bladder is because I was actually one day doing an internal assessment, and I had just gotten done assessing the muscles to see what side and how they function and where the tone was. And in an inner nudge in my head said, check out the bladder.
Mhm.
And I kinda paused, and 'cause I had never been taught how to check out the bladder, and so I, like, paused and I went, "Huh, okay, well, the bladder's up here." And I just started feeling what I felt, and there was definitely less space on the left side compared to the right side. And I'm like, "Shouldn't the bladder be in the midline?" Shouldn't it be middle? And so this was a postpartum client I was working with. And so I just encouraged it, the side that was, smushed up had less space. I just encouraged that back to the midline. And then I went back to the mammal muscles and the muscles were totally different. It had
Yeah.
totally changed tone,
Yeah.
tension, and they were able to function better. I didn't even touch them. So I started doing that for a while. And I kept noticing the bladder would always get smushed to the left,
Mm.
and sometimes to the right. But for, the most common patterns, it was to the left. And then I started, so then during one of I host an online birth healing summit every year where I interview um, people from all over the world, colleagues and professionals who teach others and are into the research and everything. And we discuss postpartum healing or pregnancy prep. And Rachel Shapiro is a midwife over in Israel. And she was talking about the uterosacral ligaments internally. And I'm like, we can reach those? And she goes, sure. And I go,
Mm.
huh. And so then it dawned on me that Rachel's a midwife. So
Mhm.
they do everything with two fingers internally, and we're only doing it with one. And so I started adding the second finger and going and checking out the cervix and seeing where I could find the cervix. And I was already working with the cervix before I had this call, but to assess the uterosacral ligaments internally was just a game changer. And,
Mhm.
and so I just started working with that and releasing that, and adding that increases or changes the pelvic floor muscles instantaneously. And so I teach a protocol in that we first assess the muscles, and then we wanna work with the bladder tissue or
Mm,
the anterior vaginal wall, whatever you wanna call it. I mean, it's to me, the bladder is right behind there, and to me, that's what I'm really making effective change with. And then going and finding the cervix and helping the cervix to refine, like, I find the cervix everywhere after birth. It is not always just in the midline where it's supposed to be. It can be
right.
anywhere after birth. And so helping that to balance out and make sure, like, my goal is to make sure that that cervix is a piñata in there,
Mm,
because the cervix needs to be able to move all the way around and move up and out of the way for intercourse to be pain free. If the cervix is restricted and that penis is hitting it during intercourse, it's going to create that deep thrusting pain. So anybody complaining of deep thrusting pain, you got to have your cervix checked out and make sure it's got good mobility in there.
right. I also I mean, my understanding and belief is it also has a lot to do with arousal as well, right?
Yeah.
Your
Yeah.
arousal will help lift the cervix up and out of the way,
If
but
it can though, if it can.
if it can. Exactly,
And that's what we're
exactly.
looking at is the restrictions that don't allow it to happen, which, it could be C-section scar
Right,
tissue.
right. Oh my
C-section scar
gosh.
tissue can anchor that cervix in place.
It blows my mind still that a lot of women who are having, whether it's emergency or not, cesareans, and then they're like, "Wait, I thought I wasn't gonna have any vaginal pain."
Yes.
And
Yeah.
it's
I
yeah.
was I was totally surprised by that too, Brittany, when, they're having intercourse pain, like
Mm,
insertional pain. And
mhm,
we know insertional pain is more of a pelvic floor muscle issue.
mm,
So why would someone who's had a C-section have intravaginal muscle tension? Well, it's the two ends of the same tunnel. So the baby's getting pulled out of the uterus, which is at the opposite end of where the pelvic floor muscles are. And when you think of it in that way, it's like nylons or socks that you put on twisted. It might be twisted up at the top, but you feel it down in your foot. That's
right.
what's happening with the pelvic floor muscles when they, like, are pulling the baby out, and, I call it the double whammy when someone goes into labor and they're laboring and trying to get the baby out, and they're trying to open those tissues and the baby gets stuck, and then we pull it back out through the abdomen. Now those tissues have been, traumatized in both directions,
Right.
and to me, that's just another confirmation that all the tissues in the vaginal space are intimately connected to the pelvic floor muscles. And when my approach to the body is we've got to address the bones first. We've got to get the bones back into their original position. And you all, if you're a therapist doing intravaginal work, you can use the tension in the pelvic floor muscles to show you where the bones are out of place.
Right.
If
It's a
you
clear map.
It is. If you have bilateral coccygeus tension, that sacrum's in flexion.
Mm,
If you have transverse perineum tight or tightness on one side, I guarantee that ischium splayed and needs to come midline.
yep.
So the pelvic floor muscles tell you what's happening to the bones. And the pelvic floor muscles are just at the effect of the bones and the fascia and the organs in vaginally. So for us as therapists to just be focusing on the muscles is totally backwards. It's
Mhm.
totally backwards. And that's all that's being taught to new pelvic TPTs.
Right. You're blowing my mind, Lynn.
Can
I
you see
mean,
how passionate I am about this?
it's just like yeah, for me, it's just like clunking in. It's like, yeah, duh. Like, but that's like,
Right.
I think specifically for pelvic PTs or OTs or chiropractors who, of course, work with like prenatal postpartum, they are so just like focused on and
Yeah,
they forget, like, you forget the holistic vision of the
yeah,
human in front of you, the
right.
woman's pelvis in front of you,
Yeah.
like, feeling around, like, I mean, in my personal practice, I feel like I always will look head to toe, but
Yeah.
also the specifics that you're talking about here are also so important with the alignment of their pelvis, the whole bowl, the bones themselves. I mean, yeah, like, I do love feeling that. I love feeling where their ribs are, like,
Yeah.
where's the whole
Yep,
spine,
yeah.
all of it, because you have to.
Yeah, and
But
when you learn to listen to where there's tension,
yeah.
to when one side doesn't feel the same as the other side, that is how I've discovered everything that I have discovered with the pregnant and postpartum body. It's just by feeling, like, does this side move like this side? Does this side feel like this side? And when it doesn't, like, getting curious with it, like, what is causing that and what is it? And, having had training with visceral manipulation and understanding that we are more than just bones and muscles and fascia, that the organs definitely have a huge impact on the fascial system and the muscular system and the bony structure of our body. Our body is going to protect those organs first. So if you have a organ restriction, your body's gonna, torque around it.
Mhm.
And that's another reason when we're doing pelvic health that we have, have to address the uterus.
Mhm.
Uterus is the central hub of the pelvic space. And the uterus is like a hot air balloon on the ground with all the ropes attaching it to the ground, trying to keep it grounded and anchored. Well, if you have too much tension on one of those ropes, that balloon's going to pull down towards that side. And that's exactly what happens to the uterus. And that really needs to be addressed in pregnancy before we give birth.
Or would you say in preconception?
Ideally. Ideally, getting things checked out prior to becoming pregnant would be the ideal space, but I have to say that even in pregnancy, if you get adjusted and you get, work done in without being pregnant, as soon as that uterus starts growing, those dysfunctions show up more.
That's true, yeah.
As the uterus is expanding, you're gonna feel the tightnesses more, and I just wish more and more women knew and understood that the aches and pains of pregnancy, we are meant to carry and deliver a baby without pain or aches.
I mean, I could say the same thing with periods.
Right? Yes. Yes. Our uterus is meant to expand and contract without any pain. And usually that pain, those aches and pains are restrictions.
Yeah.
The uterus is not able to expand freely and carry that baby freely. And we're so focused on the musculoskeletal system that we fail to look at what the uterus is doing and how the uterus might have some tension in the ligaments of the uterus, causing the body to torque around it to protect it.
Mhm.
And what we need to understand for pregnancy and birth is that the uterus, when the uterus is twisted, when the uterus is side bent, when the uterus is squashed because we have bilateral round ligament tension and that baby's going side to side, the baby cannot get into the best position to come on out. We're looking at more challenging births. And I just wish more and more OBs understood the dynamic of what's happening with baby's position in the belly. Now, I think Gail Tully has done a tremendous job with spinning babies and trying to get the word out about this idea of baby's positioning in the body.
Mhm.
I just wish more and more practitioners understood the importance of getting some release work done. They have some awesome three balancing exercises for pregnant mamas to do, and what we need to understand is that a restriction that is a restriction may not always release with just stretching or an exercise and
Mhm.
may need the help and support of a release. And that's where body work can come in so beautifully. We as PTs can do that. Massage therapists can learn to do this and OTs as well. We need, like, I just wish body work was way more accessible and known to do prior to labor.
Right.
Uh, I really, really feel like we could do a lot of women great service
Right.
in minimizing their labors by helping to get babe in a better position to come on out.
Exactly. Speaking of, right, there are many instances where I feel like in my postpartum sessions, where the first step almost to me is let's process this birth a bit, especially
Yes.
if it felt traumatic to them in any way, which
Yes.
that's not to say every single birth is traumatic because I personally also believe it doesn't have to be a trauma.
Okay, but
Like,
let's just say that hospitals don't treat birth as a natural event,
exactly.
and there's way too many interventions happening in a hospital birth that leads to the trauma.
Exactly. Yeah.
So I totally agree that there needs to be massive, massive processing after a birth, no matter how the baby comes out, because birth in and of itself can be an overwhelming experience
Right.
for the body.
Right.
And what I want people to understand is there's small T trauma and there's capital T trauma. Like capital T trauma, we know. People who have experienced capital T trauma, they know. But there's a lot of small T traumas that gets brushed underneath the rug, or moms just, it's like baby comes out and now all the focus is on the baby and they just kind of like forget about that. But your body doesn't forget, and it
Mhm.
gets held in the tissues. And there's ways to process it and to release it from the body. And it's body mind, everybody. It's not just your mind. So if you're doing talk therapy, of cognitive behavioral therapy, that's great. But that is only one level of the story. The other story is in your body and in your tissues. And just today, I helped my partner who works with me at the Center for Birth Healing, help a gal who was having a lot of scar tissue pain
Mm.
vaginally. She tore on the right side, and my partner had worked on her a couple times. She's like, "Lynn, we released some of the birth trauma, and but she's still having. It's really, really painful for her to massage the scar." And she's like, "What do you think it is?" I go, "Well, it's either more traumas in there, or we've got a nerve entrapment." And so I came in and I helped her, and there was more trauma in there. We had done a process. A lot of times, just replaying the birth in the way that you wanted it to be can be healing for the body. And the nurse that came in was awful. And so we replayed it with kicking the nurse out. But
Mm.
what we hadn't done, which we did today in this session, was actually release the nurse from the tissues. So
Mm.
the nurse had manhandled her and moved her around and did it very aggressively. And so that was stuck in her tissues. And so we needed to release it from the tissue level. And there was this beautiful softening that every time the tissue's soft, she goes, "Oh, I feel the pain." And then it would go away. And there
Mm.
was just these beautiful releases that, that is the nuance of trauma, is that there's many, many layers. There can be many, many layers of it. And to me, any type of scar tissue that is excessively painful, beyond the stretchy burniness of working with scar tissue itself. If there's anything above the normalness of that, there's usually trauma in those tissues. And when you can address and release that trauma, release the emotion that's being held in those tissues, then that pain level just goes down significantly. I had a client that came to see me years ago, and she was how old was she? She had had a C-section. I think she was 5 years post C-section. Had since, and immediately after her C-section, she had abdominal pain around the scar.
Mm.
And she went on to have 2 other more exploratory surgeries. And when she came to see me, I put my hands on those scars and I was like, "Oh," she had so much anger and so much emotion and fear from the C-section, that was what was creating the pain in there. She didn't need those other surgeries. She needed trauma release work done to her tissues. And
Mhm.
yet, our medical system just really doesn't understand the trauma response in the body and how trauma can relate to pain.
Right. It's mind-boggling how it hasn't really
Yeah.
landed,
I mean,
especially with birth.
right, I know,
Right.
and thank goodness, though, we are talking more about trauma-informed care.
Sure.
We're becoming, slowly, more aware of trauma-informed care, but I still don't think that there's enough correlation between pain and trauma and
Mhm.
how, I want people listening in to realize that not all pain is physical.
Correct. I feel like I have a hard time even calling the things that women are experiencing symptoms anymore. Like, because they to me are signs, they're signposts, they are invitations. Like, as painful as
Yes.
some of these things can be, they are like a calling to you to pay
Yep.
attention for sure. Like,
Yes.
it could be to have some sort of like release work done, like physical release work, but also maybe an emotional like traumatic release,
Yeah.
just a somatic experience kind of a thing.
Yep.
It is just maybe a lifestyle tweak that your body is just sincerely asking for.
Yeah. Yeah. Yeah.
It's
Absolutely.
like,
I
wake up.
know. It's so cool though. It's
I
like the
mean,
body is amazing. It's amazing, everybody. And its capacity to heal is amazing.
yes. Yes. I think we pin a lot of, like, problems that we have, like, the pain that we have on the
Yeah.
body, like, "Why me? Why is this happening?"
Yeah.
But it is a gift. It is, like,
It can
yes,
be,
it
right?
can be
It
a
can
gift.
be if we can look at it in that way. Because
Yes.
to me, once I realized that sometimes pain has a message,
Mhm.
pain has a job it's trying to do.
Exactly.
And if we can get to the root cause of what that job is, then the pain can go away beautifully and not have to force it. And that's the problem with our society is that if we have pain or any discomfort in any way, we just want it to go away. Why do you think addictions are so prevalent in our society? Because we're just trying to mask away what we don't want to deal with.
Right.
And my first approach, what I teach when we're working with trauma is we need to embrace that trauma response. We need to embrace the pain because it's doing something for us. It's helping us in some way.
Exactly. The analogy that I told, a woman in my practice earlier this week, I was like, "This feeling that you're getting, like this pain or just even the emotion around having it, like the anger that she had." I'm like, "This emotion is like that annoying friend that keeps asking you to hang out, and you keep ignoring her or putting her off, and you know she's gonna leave you alone as soon as you meet up with her." And
Right.
have a conversation and just,
Yep.
like, catch up, right? I mean,
Yep.
she's not doesn't have to be the annoying friend, but it is the friend that you just, like, need
Yeah.
to see
Yep. And be with.
and be with.
Yeah.
I think it's
Because
powerful just to witness, like, to
absolutely. Absolutely. And that's what we as pelvic health therapists need to become comfortable with. Like if you're a pelvic health therapist and you are uncomfortable around emotion, your clients are not going to be able to access their emotion to be able to allow it to come up to release for them to heal. Because I'm sure you've experienced this, Brittany, where you're doing your intervaginal work, you're working with the muscle, and all of a sudden someone just starts bawling on your table
Mhm.
because that emotion is being held in those tissues. I say the pelvic floor muscles are sponges. They are absolute sponges that are just holding all of our emotions in. And when we go in and tap into those, they bubble up. And they're bubbling up because they want to come out and they want to be addressed or they just want to be acknowledged. And what I have found, and because I had this myself, and we tend to attract to us our own issues, like the people on our table are our mirrors of what's our stuff to work with. But I remember I had I had this massive amount of grief coming up in me at one point in my life, and I'm like, I haven't I haven't nobody's died in my life. Like I still had my parents, my grandparents was like nobody in my immediate family or no friends had died for me to have this amount of grief that I
Mm.
was dealing with. And so I'm not sure for those of you listening in if anybody doesn't subscribe to the idea of past lives, but I agree, I believe in them. And I believe that this grief that I was experiencing was from a past life loss of a really deep love But it was this emotion coming up and it was so deep. And I just remembered like one day going, I'm just going to be with this. I am just going to let this grief come up and I'm just going to cry and I'm going to let it be and feel it 200%. And as I did that, I had this belief come up that, oh my gosh, if I feel this fully, I'm going to die.
Mm.
And that was my limiting belief. And so it made total sense to me why I have been avoiding my emotions my entire life. And I find this in some of my clients as well, that they're not able to access their full emotion or tap into the feeling fully because they have that belief that if they do so, they're going to die. We would never want to do anything that we think is going to make us die.
Of course not.
And so I've learned a technique of shifting limiting beliefs that is pretty simplistic. And so I worked with that with myself and just shifted that. And then it was like I no longer had any angst or avoidance of any feelings anymore.
Mm.
And
Do
so
do tell.
it's a little bit there's 3 steps, but there's a lot to the 3 steps that you need to
Yeah,
have. You need to identify it, you need to say it and shift it, and then you need to replace it. Those are the 3 easy steps. But there's a lot of nuance to those 3 steps to make sure you're getting it right.
right.
And so I teach that in my birth healing intensive program. So you can learn how to do that. Because you need to, it's one of the reasons why we can have held stuck energy in the body.
Right.
Like if you're working on those pelvic floor muscles and you're working with the bone and you've released the organs and you've done everything, but that muscle just will not let go, there's something else being held in there.
Yep.
And couple of times I've been able to tap into it and go, oh, there's a limiting belief here. Okay, let's work with this. And then we identify the limiting belief and then we shift it and then the muscle lets go. So there's a reason the muscles are doing, and there's a reason the muscles are tight or the energy is not flowing. And getting curious with what is causing that can be really helpful in releasing it and the problem going away for good. If we force something to release and the muscle lets go, it just comes back tighter if we didn't get to the root cause.
Right. Right. So, okay, I heard you earlier say it takes, 1 to 2 sessions, but I'm so curious, like, I'm assuming that most of your clients are coming to you kind of with this understanding already that all of this is connected and they're willing to.
Always.
Not always? Okay.
Nope.
But yeah, like,
No.
if they're not willing to go there on the first or second
Yeah.
session, right?
You
It could
can't
take some time.
you can't force someone to go where they don't want to go.
Exactly. Yeah.
That's what we have to keep in mind. And, I know as therapists, we all are very gung ho about getting rid of the pain, getting people better, and getting them functioning stronger, right? Like that's our goal. Like that's why people are coming to us. But if someone doesn't want to let go of their pain, someone doesn't want to get better, it's not our job to force them to do it. We can't. It's
Right.
impossible. And so we can only take people to where they want to go. And we can only take someone to the degree that we can go ourselves first.
100%.
Okay,
You're
so that's
yes.
important. That's
I
really
don't know about you, but at least for me, one of the first episode that I recorded for this podcast was all about, like, my personal journey and my professional journey and how mirrored they've been,
yes. Yeah.
and they are the same coin with
Yep. Yeah.
varying differing stories, and yeah, it's
I think life is so incredibly amazing that it keeps bringing similar situations up for you to heal.
yeah,
It brings the same person into your life or the same situation in different scenarios. Might have different hats on, but it's the same issue coming at you in different ways until you figure out how to heal that. And once you heal it, then it's gone, and that doesn't have to keep happening. And I'll never forget it. It's very similar to you, Brittany. I, was doing my own therapy, and I found that I would heal something on my own in a therapy session, and then the next 4 people laying on my table had that same exact thing
right,
that I could then support them in.
right.
And
Yes.
so it's so important for us, especially pelvic health therapists. I think it's even more important that we do our own work and that we get to the point where we can hold space for others to have their own process without us feeling like we have to do it. We
Yep.
have to do the work for someone because we can't. But
Right.
yet, that's where burnout happens, is when we feel over like, I've heard people say, "Gosh, it almost feels like I want them to get better than they do."
Totally, totally. When
And
I
that's
was
a problem.
absolutely. That's how I burnt out, I feel like, in my first 2 or it was 1.5 years of me working in the clinic. It was outpatient ortho, nothing
Yeah, yeah,
specific.
yeah. Yep.
When it was a great clinic, great experience, but that was what was happening for me, you know? I was so gung ho, fresh grad. I just
Yeah,
want everyone to
I'm
get
gonna make
better.
it better. And Brittany, I remember the day where I was sitting in my clinic. I still remember the clinic and where I did temp work. So I would go for 6 weeks, 8 weeks to the different clinics and help out. And I remember the office I was sitting in when I had the realization that the quality of my day was determined by how my clients were doing. That's not good.
No.
That's not good at all, right? So if you have clients coming in and, "Oh, I'm better, I'm better, I'm better." Oh, you're having a great day. But if your clients are coming in and, "No, I'm no better, I'm no better, I'm no better,"
Mhm.
then that's a problem too.
I feel like that's a discussion or a thing about placing your worth even on how
Yes.
what their outcomes are,
Yeah, yeah,
and
yeah,
just the energy exchange that does happen when you do have or don't have the ability to hold space for someone's low day.
yeah, yeah, yep.
Yeah.
It's important that we be so grounded and so connected and embodied in our own being so that we don't take on other people's stuff. We don't take on that they're not getting better. We don't take on that they just released and let go of all this grief that we feel we need to carry now. So the analogy I like to think about is that we all have holes within our being, like Swiss cheese. We are all Swiss cheese with these holes in there. And clients with similar holes come in and we resonate with them, and we may take on some of our stuff because our holes resonate. Well, it's important for us to heal our holes and try to become cheddar cheese so that there's nothing for us to take on, that we're so embodied that we don't feel depleted at the end of the day. We don't
Yeah.
feel heavier at the end of the day. It truly is my dream and hope and wish for everybody doing any type of therapy, especially pelvic health therapy, that they can start their day and end their day with the same amount of energy and excitement that they started with. So if you are finding that by the end of the day, you're drained, you're tired, you're exhausted, you are giving of yourself in your sessions. What we should be doing is allowing the energy to flow through us and not from us. Okay. So there's a huge difference. If you are giving of yourself to people, you are giving your energy from you. What I like to do is I bless all my sessions every day before I go in the clinic, and I open myself up to be a channel for the Holy Spirit.
Mm.
And to me, that channel is a flowing through me and not from me. And that's where we all need to get to so that when I start my day and I end my day, I am at the same energy level. I'm not depleted. I have more to give when I walk out of the clinic and go to my family again.
Mm.
So that is so, so important for us to avoid that burnout.
I feel like that's also a message for moms, women
Yes.
in general.
Amen. Yeah, I agree. I agree. Yeah. Because we should be around our kiddos throughout the day and not feel depleted and tired if we're allowing that energy to flow through us and not from us. We're not giving ourselves away. And energetically, I don't know if you caught this in Tammy Lynn Kent's Wild Feminine, but that's left ovarian
Yeah.
energy.
Yes.
So if you have a overextended left ovary, then you are depleting yourself. You are giving too much of yourself away, and there's not enough within you anymore. And
Mm-hmm.
so there's a shifting of that energy, and boy, those ovaries are so powerful. That left and right ovary need to be working together, everybody. And nobody knows that
Balance.
the left and right ovaries are meant to work together.
Right. Right.
Yeah. So important.
So important. That was, I feel like, a beautiful channeled message.
Oh, I did open myself up for that before we hit record, so
I love it. I love it so much.
Um,
Ah, I'm just so appreciative of people like you taking on the lessons for yourself and doing your own work and putting it together in a way that other people can now understand and then put it into practice,
mhm,
helping other women. I feel like to me, mothers really are the cornerstone of our society. They
mhm.
are integral, obviously.
Yeah, they are. And that's why, yeah, the work that I'm putting out into the world, which I'm so grateful, came from spirit. It's all come from, it's a gift from spirit that I've been aware of or have opened myself up to learn and then to share. And the work, I'm just about to finish up. We have a month and a half left of my first birth healing intensive program.
Mm,
And to just see the amount of healing that has happened for the therapists and the amount that they've been out to be able to go out and share with their clients. And I have a certification process, and those therapists that have become certified, and interviewing them and hearing how it has impacted their practice and how they're able to help support moms more
mhm,
so that moms can be more empowered, more together, more solid in themselves so that they can be better moms. I mean, that's going to change our society right there. And that truly is, my goal, my dream for the Institute for Birth Healing is to have a certified birth healing practitioner in every city in the world.
mm,
Because then I know moms will be getting the care that they need to heal fully after birth. And we talked about the trauma that birth can induce. And with trauma, we abandon ourselves. We're no longer embodied. We're no longer connected to our pelvic space, which is our home, and helping to come back home. And I call it living from the bottom of the bowl.
mhm,
That's my goal. I have a 4-step process that I teach that is somewhat from Tammy's work, but it's the visualizing your bowl, sweeping your bowl, remodeling your bowl, and then inhabiting the bottom of your bowl.
mm,
And that's the goal, is for us all to be living in the bottom of our bowl, because that's our presence, and our pelvis is our protection. It's our boundary. It's our truth center. It's our creative center. Like, this is when you're in your bowl, there's it's just, that's an amazing place to live from. And it's amazing how your life changes
the
when you're down there.
the phrase that my friends and I have been saying, is just like drop into your pussy and same difference, or even for
Yep.
the men, drop into your balls,
Yeah. Yeah.
feel that
Yep.
and how good it is to be there instead of
Up here.
way up here in the
Yeah.
head
I
and
say
the
it's such a
mind.
great it's such a great antithesis to the monkey mind.
Yeah.
It's like, get down to the bottom of your bowl, find your pussy, find your bowl, whatever it is,
Yes.
whatever resonates with you. And that's why I love, there's so many different trainings and teachers and, people talking in different ways, because there's so many people that need to hear it in the way that you talk,
Right.
that
Right.
resonate with the way you bring this work out into the world, so that's why it's so important to be authentic and be true to yourself. And I've had to learn a lot along the way of being a PT. I'm not into research. I understand the importance of it, and I'm in the process of researching this open birthing pattern in the pelvis after
Mm,
birth, and I want to quantify it. I want to show that this is a thing because I have very large hands and I have felt the ischial tuberosities where I could barely reach them. And by the time I'm done, they are here. So it's a pretty darn significant change that I've got to figure out a way to quantify it without having millions of dollars to get MRI studies. Like that would
right.
be the golden standard. But I need to figure out a way to quantify it and assess it so
Mm,
that we can get it out into the world. And so someone who does have all that money will, hey, let's look at this.
yeah,
Yeah.
very
But
important.
I have to stay true to who I am. And, I would love to um, be on stages that are only open to research-based therapists and aren't more open to the holistic piece, but that's my love. That's who I am. And I'm going to stay true to that and attract to me the people that are resonant with me.
Right. Right. Just people who are open to you. I hear that 100%. 100%.
Yeah.
I I feel a kindred spiritness
Yeah.
here. I'm totally with you. Okay, so are you taking patients right now, clients right
Yes.
now?
Yep. Yep.
Okay, and I don't know if we said where you were off the top
No, we did
on
not. So,
recording. Okay,
yeah.
so do you
No.
wanna give a spiel of how people can find you? And maybe I was curious if your summit was open to the public or just to other practitioners.
It's geared towards practitioners.
Okay.
Yeah, I mean, anybody can join in and anybody can listen in, but our conversations are more geared towards practitioners and trying to help the practitioners help more people. So, but the Birth Healing Summit, you can find out more about any of my educational classes and courses that I teach. They are more for people who have a license to touch. So if you have a license to touch the body, you can take any of my courses. I do have a doula course that you can also take if you're a doula, but instituteforbirthhealing.com is that clinic is my educational platform. And that's where you can find more out about the summit. And I also have a directory of all the students who have studied with me. So moms can go there and see if there's someone who has learned from me in my directory. And then my clinical practice, my website is Center for Birth Healing. And I am in the Denver and Longmont location outside of Boulder, Colorado. And I also do long distance healing with Zoom. So if you want any trauma release healing, birth healing work, we can do that via Zoom as well. So you can reach out both, and that would be at the Center for Birth Healing.
Got it. Oh my gosh, Lynn Schulte, everyone. Thank you so much for being here and
Thank you for
share.
having me. I love this conversation. I know we could talk for
Same.
hours.
Absolutely. As soon as I hit stop, we're going to keep talking.
Right?
Well, thank you everyone for listening. We'll see you next time.